Doctor, thank you. Up next, we have Christine. Christine H. If you'd go ahead and unmute yourself, please.
Hi, doctor. Thank you. I'm a type 2 diabetic and been on the vegan diet, starch-based diet since January.
Good.
And my blood sugar is going up and up and up. It was over 200 this morning, and I'm just wondering if I should worry about that.
Are you trim? How tall are you?
I'm 5'8".
Okay. Are
And
you fewer than 125 pounds?
I'm 195.
Okay. Well, until you get to be 125 pounds or less, you can't declare yourself a failure. Okay. So you got what, another 70 pounds to lose. And once you do that, then you can find out whether or not you truly are a type 2 diabetic, because you may not be. There's a spectrum between type 1, where you don't produce any insulin, and type 2, where you produce as much insulin as the general population, sometimes twice as much insulin. It's just the insulin doesn't work because of insulin resistance created by being too fat. Okay, but in between, there's a spectrum of partial pancreatic insufficiency, partial inability of the pancreas to make enough insulin for your needs. You make enough insulin to, say, kick you out of the hospital, but not enough insulin to make your blood sugar go down to normal. So I would guess a couple of things. One, don't declare yourself incurably ill. You've got another 70 pounds to go. And you'll get there eating a starch-based diet. I mean, the body naturally doesn't want to weigh what you weigh now. And so it will lose the weight. You just got to make sure you stay away from the nuts and seeds and avocados and other fatty, oily foods. They make you fat. A lot of sugar is not a good idea either, even though sugar does not make diabetes worse. Actually, sugar makes insulin work more efficiently, but that's a whole other story. You'll have to read the science. You'll have to read the research to figure that one out. What do you think? A lot of people out there give you their opinions without knowing the science or research. Anyway, all this stuff is free on my website, like the diabetes thing. I don't know. Anyway, it's if you just look on the search and put in diabetes, you'll find 2 articles I've written, one 20 years ago and one 20 months ago on diabetes. And as I say, every diabetic has a better life when they change their diet, because diabetics are destined to blindness, kidney failure, early death, cancers, all kinds of things. So you're blessed with a better life once you change your diet, even if you can't get off your insulin. All type 2 diabetics can get off their insulin or their diabetic pills. All. People who have type 1.5 diabetes, in other words, that spectrum, partial pancreatic insufficiency, they may need some insulin. If they lose too much weight, I put them on a little insulin. If they develop too frequent urination, I put them on a little insulin. If they worry about their blood sugar numbers, I sometimes put them on a little insulin. And there's type 1 diabetics who make no insulin, absolutely require insulin injections, absolutely.
Thank you, doctor. And up next, we have Lisa B. If you'd go ahead and unmute yourself. Thank you.
Thank you. Hi, Dr. McDougall. It's so nice to see you in person. I've been following you. I've been vegan almost 3 years now. And I follow you and Dr. Pam Popper and Dr. Esselstyn. I watch all your videos on YouTube. I can't find a plant-based doctor in my area for nothing. I live close to Santa Barbara. And all the doctors I seem to get, I tell them I'm vegan, plant-based. They tell me I need to make out a will. I don't know what I'm talking about. They don't seem to know who any of you plant-based doctors are. And so I'm having a hard time trusting anything they say. One doctor told me that I need to get off my 50 microgram Synthroid that I've been on for 15 years. She did an antibodies test and said I don't have hypothyroid anymore. So is that a test that you would trust to decide?
It's called a TSH test, thyroid stimulating hormone. Yeah, I would trust that, but you need to get it 6 weeks after you stop taking the supplement. You can't get it right away. You can't stop the supplement and then get the TSH level. You have to wait about 3 to 6 weeks before you repeat the test to see if your thyroid is functioning normally. So as far as picking a doctor, ma'am, hey, you're the customer. You should pick somebody who can do the things you need done. For example, if you have plastic surgery done, you want to have an artist. If you're having a baby, you want to have a good catch. You know, you just want to hire somebody who has the talents that you're looking for. For my patients, I tell them to get out of the business, get away from doctors, get away from pills. And the way you do that safely is you eat well. You stop the cause of the problem, which is the food. I hope you picked that up so far. It's the food. So you get yourself healthy. Nobody else is going to tell you how to eat. You already figured it out. You've been with us for 3 years. You already figured it out. And, you just need somebody who will provide the services that you want. You're worried about your thyroid, any general doctor can check those tests for you. The other thing, hey, I'll throw out as another option is once you become a McDougall patient, then we will take care of you for life through our telemedicine program. That's the only way we take outside patients. You have to enroll in the 12-day program. And the reason is because I'm tired of one-night stands, ladies and gentlemen. I am tired of seeing people for 7 minutes and then expecting me to make a big difference in their life. It just doesn't happen. So for the last 44 years, I've refused to take people from the outside into the practice unless they're willing to dedicate some of their life, some of their time to learn how to take care of themselves. I cannot take care of you. I give you some advice, but you got to take care of yourself.